Hey beauties, welcome to my channel. Thank you for tuning in. If you are a newbie here, welcome and thank you for being here. My name is Laverson. I am your host and I am also the founder of BeyondBody.com. In today's episode of Let's Ask the Surgeon, we are finally going to find out who the man is behind the surgical scrubs. If you've been following us, and following this episode rather, you already know that we've been getting into surgery specific questions, but in this episode we want to find out who is Dr. Laverson. We already know that he's smart, he's educated, and he is very good at what he does, and that's why I wanted to put those episodes first so you guys can see that he is absolutely qualified. He's not one of the top surgeons in San Diego for no reason. He's really good at what he does. But now I want us to get to know exactly who he is. So in this episode of Let's Ask a Surgeon, the topic is called Who is Dr. Laverson? Hey, Dr. Laverson, how are you?
You know you're making me uncomfortable, Loree, because the focus of what I do is really the patients. I feel uncomfortable. I'm not good at being the center of attention, but I love hearing from you, and I love what you're doing, Loree, and getting the good word out there and information that people want. So I will participate with pleasure.
Yes, because we need to know who this guy is with the magical hands. Like, we need to know.
Thanks.
So, I guess the first question that we're going to ask is, where were you born, Dr. Laverson?
Philadelphia, the city of brotherly love.
Hey, okay. Yep. So, what brought you here to San Diego then?
Well, the weather. I mean, I trained. I went to medical school back east in Baltimore, and I knew that. So when you specialize as a doctor after medical school, you have to do like what's called a residency. It's basically like an apprenticeship. Okay, you work with the professors and the senior doctors, and you start out. The program is years long, and it's a graduated level of increasing responsibility. And that means that when you start out, you have basically no responsibility. You do what you're told. And then the next year, you get a little more responsibility. You're assisting in surgery. And then the next year, you're actually doing small surgeries and doing some teaching. And the whole time you're learning, you're working with professors, go different kinds of surgery. So that residency I did in Los Angeles, because I realized that if I only get out of the hospital one day every 2 weeks, which is the way it is. I mean, they call it a residency because you live there in the hospital. And I said, look, when I get out for that one day, I want the weather to be nice. Okay. I don't want, like Baltimore, it's gray, it's cold, in the wintertime. And LA is nice. And I finished my general surgery training at Martin Luther King, South Central LA General Hospital. Was a great hospital, and did my plastic surgery residency in New York. So you sort of just go around. I liked going to different places. I did a fellowship in Georgia outside of Atlanta. I did a fellowship in Philadelphia. I did a fellowship in Chicago. And I spent time at a lot of hospitals, UC San Francisco, Stanford, just to see how things are done.
Right.
different people do things differently, and that was really good for me. Anyway, go ahead. Yeah.
Look, because you always be on top of it because I swear those are like the next questions. Okay, so when did you first know that you wanted to be a surgeon and what attracted you to this field of work?
Well, that's another good question. You know, Larice, I spent my I'm fooling around with this computer. I'm sorry. Um, yeah, when I was a kid, okay, you sort of find what you're good at, and I was not really good at a lot of things, but I was good at art. Okay, so
Okay.
anytime they needed something drawn, they would call Laverson. You know, here, have him do it, and it would be, you know, a poster for the dance or poster for this or that, you know, fundraising thing or whatever. And I did a lot of cartoons in the back of the room and stuff like that, and you know, I started out actually when I was my dad. So my dad was a teacher in art. He was an art teacher. He was sort of an artist also, but he couldn't make a living, okay, being an art teacher. And it's funny you ask, Larice, because, you know, the story goes on and on. I won't bore your audience, but he wasn't doing well at that. And he taught in Philadelphia, and you know, one of his kids said, why don't you get a real job? You know,
No.
this guy was in his art class making book in the back of the room, you know, and he was making all kinds of money. And he said,
Right.
and you know, my dad was a teacher. Tell him, listen, you got to put that stuff away. And he said, you know, Mr. Laverson, why don't you get a real job? And you know what? He thought about it, Larice, and he went back to school, and but I inherited his artistic ability, and he was a child of the Depression. They grew up poor, and you know, he thought being a doctor was just a great thing, and he pushed me toward that. And I did well in science, and I wanted to make my dad happy, like we all want to make our parents happy.
True.
So I did get into medical school, Larice. I studied hard and did well in science, and I got into medical school. But the truth is, Larice, when in the third year, when you get out there in the hospital, in the clinics, I did not like it. Okay, because I did internal medicine, which honestly, Larice, okay, so it's diabetics, it's heart failure patients, it's cancer patients. Some of the
Mm,
drugs we were giving them, and they would bounce back at the hospital. The heart failure patients, you never got them really out of heart failure. You would control it, but you couldn't get them better. And the
right.
diabetics, same thing. You control their sugar, but the complications of diabetes, they come in more and more. And cancer patients, my God, the drugs were as bad as the disease. You know,
Hmm.
therapy, and it was depressing. You know, the patients, you weren't, I wouldn't really get them better. But then I saw surgery. Okay, then I saw surgery, and it's funny, Larice, because and on the medicine service, when somebody's really sick, you know what the internal medicine residents do? They say, call the surgeon. So I said, you know what? That's for me. That's for me. I want to make patients better. I became a doctor. I want to make patients better. And then when I got into surgery, I learned about plastic surgery, which was artistic. I said, holy cow, this is for me. You operate on men, you operate on women, you operate on kids, you operate on older people. Um, some of these specialties like OBGYN, you're just women. Urology,
Hmm.
mostly men. Um, cardiology, it's mostly older people. I mean, you know, so pediatrics, it's all kids. I said, look, plastic surgery is totally for me. All different kinds of people. You're dealing with beauty. It takes creativity. So I felt like
Hmm.
I was cut out for that. That fit my aptitudes, my natural interests.
That's pretty cool, man. Like it started out with art and it turned into this. That's
Yeah,
unique, like for real. I never would have thought that or put that together for real.
yeah, yeah. That's it, Larissa. And I say it's true with everybody. You know, you got to find what you're good at, what you're interested in, and the old saying, as the old saying goes, if you find what you're good at and what you like, you'll never work a day in your life.
That part, I swear, is so true. It's very true. It doesn't seem like work. It's just you're having fun doing what you love.
Yeah.
So yeah, I agree with that for sure, 100%. All right. So the next question, like you pretty much answered this. What school did you go to and how would you describe medical school?
Well, when you're going through it, I went to University of Maryland in Baltimore. It's downtown near the Inner Harbor, near the projects, and that was good training, good place to train, because you see all kinds of stuff, and people don't. A lot of people aren't taking care of themselves so well there. So you see advanced disease states and learn how to manage them. So University of Maryland was, plus University of Maryland, Laurice, fit me because it was a very, very patient-centered medical school. It was all about the patients. The doctor is not, the doctor is only there to provide the service for the patients. And I like that. And I went out to UCLA where I started my surgery training, and the surgeons are all stars. They're publishing, and they got the entourage of residents and fellows and visiting professors behind them, and they leave the room, and the patient saying, I was like the last one, the medical student, their intern, the patient saying, what was that all about? So what does it mean for me? I mean,
right.
Am I getting better or am I getting worse? What was that all about? So it's sort of interesting, but I like Maryland Medical School, and it was, I went to med school. I was 21 to 25 years old. And Laurice, when you're young, you got to make your way in the world. You feel insecure. What am I going to be? Am I going to get in? Am I going to be accepted? And you're just trying to find your way, and that's all. It was a good time, though. All in all, it was a good time.
Right.
Looking back, there was always that stress, the exams,
All right. Are you still there, Dr. Laverson? You froze
I'm
up.
here. Can you hear me or no?
No, I can hear you. You just froze up, but you're good now.
I'm sorry.
Nope, it's all good.
Yeah.
All right. So the next question. If you had to choose, what is your favorite surgery to perform and why?
Oh, well, thank you so much for asking that, Laurice. I like doing a lot of surgeries, but it's not about the surgery. When the patient is happy, I'm a doctor. I mean, I take care of people. I mean, Laurice, you were like a perfect example. You came in, and I think your story is compelling, how you lost weight on your own, woke up one day and somehow got motivated to change and say, look, I don't want to live like this anymore. I'm going to change. And you did it successfully. So many people want to do that, but can't. You come in, and all I was really an accessory toward your end vision. Okay. Yeah. And you have two beautiful kids. And we all know what pregnancy does to the woman's body. It stretches it, you gain weight, the hormones change, the skin sags, the breasts flop down. I mean, all these things happen in exchange for bringing life into this world.
Yes.
And it's unfortunately, we live in a world where the woman always wants to be beautiful, and you should be beautiful and feel beautiful. So that's what I like doing, however I do it, whether it's the breast, the face, the nose, we do noses, face, aging, mostly anti-aging. And then, of course, breast augmentation, breast lift, tummy tucks, lipo, fat transfer, all these things we do. And I like doing all of them when I get a good result. We want no complications. We want a good experience, as good as it can be for the patients. There's no way you can take the pain out of surgery, the recovery, the uncertainty, all these things are sort of difficult because life goes so fast for everybody these days. It's hard to take time off to recover, harder probably than it's ever been, so we try to make it as easy as possible. It's like that Staples easy button, we want it easy as possible.
Yeah. Easy button. Yep.
Easy, good result. Good result. Beautiful. We want the best.
Well, you just answered. You just look. I swear you're in my thoughts. And look, guys, just for the record, I do not give him the questions previously before the interview, and he just answered the next one. So we're not even going to go over this one, but it says, "What is your ultimate end goal for each patient?" And you just said.
My goal is their goal.
Beautiful.
Yeah. My goal is their goal. You come in, the first question I'm going to ask is, okay, what do you want? What's your vision for your own end result? Because for somebody to come in for surgery, Laurice, as you know, it's got to really be bothering them. Okay. It's not just a small thing. It's something that either, they don't look good in clothing. They can't fit in their clothing. They remember what they used to look like. They don't like it anymore. Maybe a significant other is treating them differently. Maybe other people are treating them differently. Who knows, but people do have their motivations.
Right.
And I've got to understand those motivations and say, okay, so what is it you visualize? And as much as they can, explain to me their vision, that's got to be my vision for them. Okay. And that's my goal is to provide that service to make them, to create for them the result that they visualize.
Right. Yeah.
Even better if I can.
Yeah. Hey, yes, you do a really great job. I'll say that.
Thank you, Laurice.
All right. Next question. Do you offer consultations? If so, how long are the consultations and are there any fees associated?
Okay. So of course we have consults, both virtual. Sometimes we'll have a FaceTime if it's an out of town patient or patient who can't get into the office easily. We'll do a FaceTime or Zoom or something like that. And then how long are the consults? We usually set aside an hour. It may not last the whole hour, but we set aside an hour because I do want to get the questions answered. I want to communicate enough so that the patient gets their questions answered. They feel comfortable with me and that I get enough information from them to know if I can create for them the result that they want. Sometimes it's not possible,
Right.
So I've got to let them know that and understand what they expect, the fee. Okay. So
Wait. It's good that you just said that. I'm glad you said that because the expectations do need to be realistic, and I like that you said, if it's possible, because some people go into this thinking like surgeons can just, it's magic, you know what I mean? Like it's not it's not magic, they might think, oh, I want to look like this lady or this person, and then their body type might not allow for that outcome that they're wishing for. So I'm really happy that you just said that.
You're absolutely right. Yeah, I'm struck most dramatically every day by my own limitations, the limitations of the human body, of blood supply, of skin, and we do our best with what we have, but it's you can't always do what you want to do.
Right. All right. And then
There's
you were about to answer.
We charge $25 for the consults. And the reason we do that is because patients don't show up. I mean, if you don't charge, they feel like, oh, I'm not paying, I don't show up.
Yep.
Charisse charges $25. So at least it's an incentive to show up. And that's all. Because I've got my nurse, my medical assistant, Charisse, the office. We schedule time and we're taking time away from somebody else, and there, sometimes we book out like weeks in advance. There might be somebody who's 3 weeks from now who wanted that spot right now because of their schedule. And if somebody doesn't show up, well, it's not. So we try to do that. That's why we charge $25, and the $25 goes towards your procedure. If you
that makes sense though. That makes sense. You time is money. You guys are working, so it incentivizes that they're going to show up. Nobody wants to waste their money either, so they'll show up if they got to pay for it.
Yeah, a little bit.
All right. Next question. Where can people find your office, or how can they book a consult with you?
Okay, so we're in San Diego. Our website is feelbeautiful.com. All one word, feelbeautiful.com. You go on there, you can ask a question, schedule a consult even online, or call during the day. If you have questions that the website doesn't answer, call Charisse is at our front desk, and I try to be available as much as accessible as possible to patients and people who are interested in finding out. So that's it. There's the phone number at the bottom, Laurice. Thank you very much for putting that on there. We're feelbeautiful.com, and even if you don't have a consult, if there's a specific question, we'll be glad to answer it.
Awesome. Let me put Feel Beautiful up there so they can write that down.
Thank you for what you're doing. I love
Yes,
it. I
yes.
appreciate it very much. Thank you.
I appreciate you. I'll see you next time, Dr. Laverson.
All right. Thank you,
Bye.
Larissa.
So you heard it. That's Dr. Laverson. It's always awesome to talk to him. But yes, so now you got to get a feel for who that guy is behind the medical scrubs. Like I said, he is one of the top surgeons, top rated surgeons in San Diego. Google him, look him up. He is thebomb.com. So that is all for the episode of Let's Ask a Surgeon. Stay tuned for another episode. As always, if you have any questions, comments, or concerns, make sure you leave them down in the comment section. And if this is something that you like, if you want to follow along my journey, make sure you subscribe to my channel. Make sure you hit that bell notification so every time I upload a new video, you will be notified. Take care. Bye, guys.